All right, we'll go ahead and get started. Thanks, everybody, for coming out. My name is Girish Shroff from MD Anderson, and this is the chest radiology review track. So we're going to have 5 talks in this session. I'll be doing the first one and the last one, and we'll have 3 other ones in the middle. The first and last will be kind of didactic talks, and the 3 in the middle will be rapid-fire case reviews. All right, so the first talk will be on TNM lung cancer staging. I have no disclosures. So what we'll do in this talk is basically go over the changes that have been proposed for TNM 9, which is planned to take effect in January 2025. So in summary, for the T category, there's been no change from TNM 8. For the N category, for ipsilateral mediastinal nodal disease, which is N2 disease, that remains N2, but now N2 has been subdivided into N2A and N2B. So N2A, if a single ipsilateral mediastinal nodal station is involved, N2B for multiple ipsilateral mediastinal nodal stations. For the M category, multiple extrathoracic metastases remains M1C. It's M1C, but that has also now been subdivided. So if there's a single distant metastasis, one organ system, I'm sorry, let me say that again. Multiple extrathoracic metastases, so if a single organ system is involved, it's M1C1. Multiple distant extrathoracic metastases, meaning multiple organ system involvement, is M1C2. So what we'll do is kind of review the whole TNM system. So for T1, so T1 tumors are less than 3 centimeters in size, and here are the subdivisions of T1. Again, this is all unchanged. T1 tumors are surrounded by lung or visceral pleura, and T1 tumors can involve the lobar bronchus, but not more proximally. So here are examples of T1 solid lesions. So importantly for solid lesions, measurement is the longest diameter of the tumor. So here are examples of T1A less than 1 centimeter, T1B 1 to 2 centimeter, and here on the right T1C from 2 to 3 centimeters. Now for part solid lung adenocarcinomas, T staging is important to remember. T staging is based on the longest diameter of the solid component, and that's the invasive component. So it's been shown that invasive size, measuring the size of a solid or invasive component is a better predictor of survival than total tumor size when we talk about part solid lung adenocarcinomas. So here are the subdivisions for T1 part solid lesions. Again, it's the longest diameter of the solid component that gives the T stage. So moving on to T2 tumors. T2 tumors are 3 to 5 centimeters in size. Subdivided here, or tumor of any size with involvement of the main bronchus, regardless of distance from the carina, but not involvement of the carina, which makes it T4. Partial or complete lung atelectasis or pneumonitis is also a T2 descriptor, as is invasion of the visceral pleura. And here are a couple examples of T2 tumors based on size. So 3 to 4 centimeters is T2A, as on the left here, and 4 to 5 centimeters is T2B. Again, lung atelectasis, whether partial or complete, is a T2 descriptor. The image on the left shows a central obstructing left upper lobe tumor with left upper lobe collapse, post-obstructive, so that's T2 descriptor. The image on the right here shows a left mainstem bronchus nodule associated with complete atelectasis of the left lung, which is also a T2 descriptor. So T3 tumors range from 5 to 7 centimeters in size, or tumor of any size with separate tumor nodule in the same lobe as a primary tumor, or invasion of the chest wall, phrenic nerve, or parietal pericardium, all T3 descriptors. And here are a couple of examples. So here we have a left apical primary tumor, separate tumor nodule in the same lobe is a T3. And then here on the right is a patient with a right upper lobe tumor that's associated with chest wall invasion, also a T3 descriptor. So T4 tumors are greater than 7 centimeters in size, or tumor of any size with separate tumor nodule in a different lobe of the same lung as the primary, or invasion of any of these structures, also T4, including diaphragm, mediastinum, heart and great vessels, vertebral body, esophagus as well. So a couple of examples of T4 tumors based on size. So here's a large right lung tumor greater than 7 centimeters in size, so that's T4. Here's a large right lung tumor associated with chest wall invasion greater than 7 centimeters in size, so that makes this T4 as well. Another example of T4, this is a patient with a right lower lobe primary tumor, separate tumor nodule in a different lobe of the same lung in the right middle lobe here, so this is also a T4 descriptor. So tumor here on the left, left image shows this large tumor associated with pulmonary artery invasion, so that's a T4 descriptor, and the image on the right shows a left lower lobe tumor invading the diaphragm, so that's also T4. And a large left apical tumor here associated with chest wall invasion, and then also vertebral body invasion, so that makes this T4. So the N category, just to review, N0 is no regional nodes, N1 ipsilateral bronchopulmonary or hilar nodes, N2 again is ipsilateral mediastinal nodes including subcrinal nodes, and here's the new subdivision. So a single N2 station involvement is N2A, multiple N2 station involvement is N2B. So it's not the number of nodes, but the number of stations. And then N3 is contralateral hilar mediastinal or any supraclavicular or scalene nodes is N3.